introduction, phlebotomy or venous blood sampling is one of the most frequently performed procedures in both inpatient and outpatient settings. The arm is the best site from which for drawing venous blood. The upper extremities contain easily identifiable and accessible superficial veins, especially in the antecubital fossa, and allows the patient to control excessive bleeding at the site of venipuncture by application of local pressure. Vacutainer system. Nowadays, for blood sampling, vacuum-containing tubes are used all over the world. These are the vacutainer tubes. The tubes may contain anticoagulant. The anticoagulant can be easily identified by the color of their caps. Different color codes the tubes without anticoagulant. So over here I have a picture, and in the picture A describes the vacutainer tubes, and B consists of the passive shielding blood collection needle. C is blood collection needle and holder. When vacutainer tubes are pushed into the holder, the needle safety shield releases automatically and the vacuum sucks blood into the tube. And D, you have blood sampling with vacutainer system. Next, you have the classification of the different types of tubes and their colors and what the type of needles that will be needed. Moving on, the equipment needed for venous blood sampling. You need a tourniquet, materials for skin disinfection, gloves, syringe or vacutainer, needle for the syringe, 20 gauge, specimen tubes or vacutainer tubes with appropriate anticoagulants, gauze pads, self-adhesive bandage, labels to identify the patient, containers for used needles and hazardous waste. So the procedure. In the procedure, the patient should be positioned comfortably with the upper extremity resting on a table or bed. If the patient is in bed, the supine position is preferred with the arm resting on the mattress. If the patient is ambulatory, the sitting position is best. After seating the patient in a comfortable position, apply the tourniquet above the antecubital fossa in such a manner that it may be quickly removed with one hand. The tourniquet should be snug but not so tight that it causes discomfort, and it should not be left in place for so long that the patient's arm becomes cyanotic. Have the patient open and close his or her fist to help pump blood from the muscle compartments of the arm into the superficial venous circulation. Select a suitable vein by palpating the antecubital fossa with the lip of the index finger, feeling for the buoyant resilience of a distended vein. You can use the antecubital vein, the cephalic, basilic, or the median cubital. Or you can examine the forearm on both sides and use the superficial veins on the dorsal surface of the hand instead. Moving on, select a suitable vein by palpating the antecubital fossa with, I'm sorry, I think I have repeated the same thing. Cleanse the skin around the planned injection site. Hold the syringe or vacutainer in the dominant hand while palpating the vein with the index finger of the non-dominant hand. Apply traction to the skin below the proposed site and make sure the bevel of the needle is up. Align the needle with the course of the vein. Punch the skin at an angle of about 15 to 30 degrees with a quick motion. Then carefully advance the needle into the lumen of the vein. If using a syringe, blood will flow back into the needle when a small amount of negative pressure is applied to the syringe. If using a vacutainer system, it will be necessary to press first vacuum tube onto the needle to look for inflow of blood into the vacutainer. Gently hold the needle with a non-dominant hand while aspirating with the syringe in the dominant hand. After the required amount of blood is withdrawn, stabilize the needle with one hand and release the tourniquet with the other. Remove the needle quickly and smoothly without putting any tourniquet on it. Have the patient apply direct pressure on a piece of gauze pad over the site for 3 to 5 minutes. If needed, apply a self-adhesive bandage onto the gauze pad. Label the tubes with the patient's name, date of birth, or insurance number and send them into the lab. Throw out the needle into a special container and syringe into container for hazardous waste. So here so far I've described the venous blood sampling and how you're supposed to send it to a lab for further investigation. Thank you very much.